Hi guys, welcome to another podcast. It's been a while, hasn't it?
Yeah.
Since we've done one. So today we've got Paul. You all know Paul by now, personal trainer at Fitness Factory.
Yep.
Yeah.
That's me.
Biggest guy in the gym. Strongest, I know that. One of the strongest.
Probably, yeah.
And then we've got John. You all know John.
Yeah, the second strongest in the gym.
Not the biggest.
Not yet. We'll see.
And then we have two special guests today. We have my son,
Hi, all right?
Adil. If you've never met him before, this is Adil. It's going to be interesting.
That'd be fun.
Yeah. And then we have Dr. Dimi with us today. So
Nice
I'm going to
everyone.
let Dr. Dimi introduce himself and tell you all a little bit about himself.
Oh, fantastic. Well, thank you for having me in the podcast. My name is Dr. Dimi. I'm a lifestyle and longevity medicine consultant. My main focus in my practice is treating aging as the main driver of disease. So we know that as we age, the risk of developing diseases of aging is increasing. So we're talking about Alzheimer's, dementia, cancer, heart attacks, strokes, diabetes, etc. So as we know in the current kind of medical practice, we wait for those diseases to happen and then we just give you medications trying to manage the symptoms. Whereas I go a step back and trying to deal with the root causes, which is the aging process itself.
You're going to shut down the whole pharmaceutical industry then.
Well,
They're not going to like
I mean, getting hate already. No. But no, it's medicines are important. It's how we combine lifestyle.
Yeah, it
and
makes sense. It makes sense.
Pharmaceuticals, yeah.
Obviously we'll delve a little bit more into what you do,
Sure.
but one of the the topic today initially is about, fat shaming, but I'm not going to use the word fat shaming because I don't like the word fat. So we're going to say body shaming. So John actually brought this to my attention. I think you watched something, right, on Instagram and...
Yes, I came across something on Instagram on the Reels, and it was an individual going on about how fat shaming in today's society is extremely unfair, and being fat doesn't constitute being unhealthy, and people should have the choice to be fat and be who they are and everything else like that. But as all of us sitting here know, there are a lot of health risks that come with being overweight and obese. And personally, I think a lot of us think that those issues as a society need to be addressed.
Yeah.
That's it, exactly.
Yeah. So it came from that, and I think you sent me the clip, and I watched it. So we said let's have a conversation about body shaming, and then obviously Paul said, "Oh, I have got the perfect guy who's going to back it all with science, and he's got the qualifications and everything." So so you're here to set
Kick some knowledge.
Yeah, some knowledge. That's the word I was looking for. And then obviously Adil is here just for...
Moral support.
Well, to be fair to you, Adil, you do have qualifications within the field that
Adil
we
is
do think are helpful.
Yeah, I am a lecturer, so
Adil's a sports lecturer.
I deal with health and fitness from a young age and trying to teach and educate students to become healthy and fitter. My speciality is sports science, so I have a better understanding of it. I've grown up in the fitness industry. I've been around the fitness industry. Been with the gym since I was a kid. So
since he's a kid.
So I'm kind of involved in it. I've seen different things, and obviously I like sports and I like health and fitness. So I think that's going to be my take on the situation today.
So John, you've got some stats there. You're going to read some of those stats out because they are quite interesting, aren't they?
Yeah, so these are just some overall stats on obesity and overweight individuals within the United Kingdom, mainly focusing on England itself. So we'll just kick off. So a health survey for England in 2021 estimates that 25.9% of all adults in England are obese, and that a further 37.9% are overweight but not obese. Health implications wise, if you're overweight, you're twice as likely to have a high blood pressure, so that's hypertension. Severe obesity can reduce your life by 14 years. I thought that was a massive statistic. 14 years, huge.
Yeah, I've got one here that says in 2023, it is estimated that 63% of adults are either overweight or obese. with 28% falling into the obese category. That's
You say 14 years of someone's life?
yeah,
14, be up to 14
That's
years
crazy,
of someone's
isn't it?
life.
I
Yeah.
don't have a lot left then, do I? I'm on my way out.
The severe
I think we
obese
need to dwell
individual
into
you
it
are.
a little bit more though, like in the sense of, and we talked to you about it, BMI. So obviously these stats are taken on the BMI scale and looking at where people are at the BMI scale. So being overweight, then you've got obviously obese and then slightly obese, etc. So, like for example, we were discussing earlier before we came here, debating BMI is accurate or not. So for someone like Paul, who's huge,
Huge. Your
big-
BMI is off the scale.
you're off the scale.
Do you know what?
Was it,
do you know
what was
the-
it again?
Yeah,
we looked at-
I looked it up this morning. He is severely overweight.
Morbidly.
As you can
Isn't
tell.
yeah, don't they use the word morbidly?
So no, yeah. So that's I think it's severely obese that
you
they're
got
using instead of
clinically-
morbidly.
Yeah,
Yeah.
clinically
Um,
obese, and then
yeah.
you got dangerously obese, and then you got obese.
Would
So
you
where was
say,
I?
Would
So
you say Paul
hit
is
the
obese?
obese category.
No.
No,
You
based
were-
on the BMI, no. So
Okay,
we,
we'll let the doctor speak.
well, we still use a BMI because it's so easy to kind of a quick clinic calculation where you just get the height, the weight, and then you come up with this metric. Now the problem we have with the BMI is it doesn't actually take into account the muscle mass. So someone like Paul, for example, can carry a lot of muscle, but little fat. His BMI will still be elevated. So it will push him into the overweight or obese category, indicating that he's carrying a lot of fat tissue.
Yeah.
But as a matter of fact, it's not fat, it's muscle. So that's the issue we have with the BMI.
Yeah.
So in a population setting, it's useful because most people, they don't carry that much lean muscle mass.
Yeah.
So it actually correlates quite well in a population setting. But if you have special populations like bodybuilders,
Yeah, yeah.
fitness enthusiasts, et cetera, that carry more muscle mass, then it becomes less and less accurate.
Yeah, and that's always been your bugbear.
Yeah, I mean, because I'd say that every single individual that I work with, myself included, if you put us through a BMI, I mean, I come out as overweight. You know, I'm not a massively huge individual. I only weigh 82 kilos, but I hit overweight category on a BMI. So that's why it's just, for me, it's a struggle to trust it, you know?
Yeah, but I think that's because he's obviously got.
Team goer, et
It's
cetera.
an easy indicator. It's simply just weight and height. And I think if you want to get more accurate representation, you have to get skin fold calipers in. Then you need specialists to do that. Then you got hydro weighing scales, which are going to give you more of an accurate reading. You can only get them in universities and special places where BMI is quite easy to get.
What about if someone went on a DEXA scan for the body fat? Would that make a difference?
Yeah, I think that
Yeah.
definitely
It's
makes
quite
sense
clear.
because
Yeah.
that takes into account your, like, you know how we have the in body.
Yeah.
That shows you what your muscle mass is and
But then
everything.
it's affected by hydration levels. So if
Yeah.
you're dehydrated on the day, then your body fat percentage is going to be lower.
So,
Yes, yeah.
That's-
Well hydrated, and so on. So there's loads of different,
It's
loads of
subjective,
different
isn't it?
factors.
Yeah.
But I think with that body shaming itself, you're looking at the person and you're making that observation on what they look like. So
Yeah.
for example, you might say, "Oh, you sure you want to eat that?" Or you put on a bit
Yeah,
of
but
weight.
that's body shaming, isn't it?
Yeah, that's what I'm saying.
If
Yeah,
you
yeah.
see somebody that's, say, a bit overweight and you say, oh, should you be eating that? That's body shaming, right? But where this conversation that John was listening to was about body positivity, right? Which I'm all for body positivity. We've said it over and over again.
That's
that,
why
you
you
know,
own a gym, though, right?
it's-
It's literally what we're doing here.
yeah, that's what we do. But we encourage all shapes and sizes. We're not saying that everybody should look a certain way, right? But where can you then draw the line on body positivity? So if somebody is obese, okay, and everybody around them is saying, nah, you're fine exactly how you are. Just carry on. You carry on. It's fine. Like, if you're that person's friend and you know that they are obese and they are going to end up with diabetes, high cholesterol, potentially cancer, lots of other illnesses, right, related to being overweight. Are you really being honest with them? Like, are you really helping them by saying, oh, no, we're being body positivity and we want to, support everyone. We don't want to make anybody feel bad. Like, where is the line? Do you know what I'm saying?
I think that would come down to how well you know the person.
Yeah.
Do you know what I mean? If it's someone that you just kind of know, you probably wouldn't say anything.
Yeah.
If it's someone you're close to,
Yeah.
like a family member,
So it depends on who's telling the person.
yeah, I'd say so, yeah.
So if it was my family member or a close friend,
Yeah.
I feel I would say something. I feel I would say something because I care about that person.
Yeah, of course.
Like-
I think it's the way you say it, though. As well, at the end of the day, I think some people don't mean any disrespect by it, but some people might take it in the wrong way. We live in a very sensitive society where people do take things in the wrong way.
Yeah,
Like
but,
you may say let's say you said it to me that, oh, Adil, you put on loads of weight.
I tell you.
You would tell me, I know you would. You told me when I got married, I put on weight. But to me, I'm happy. I don't think I was fat or had an effect on my health. I think I'm quite a healthy person.
The thing is, though, some people that are overweight are actually healthy. It's actually not good to be low in body fat.
Yeah.
It's actually bad for you to be low body fat.
But this is what I'm saying, though, that there's being slightly overweight.
Yeah.
So you're not this Instagram size 8, 10 or whatever this ideal weight is. There might be a
But
woman that's size 12.
what is the ideal
Yeah,
weight,
but
though?
this is what I'm saying. But then what if you're obese, where that is dangerous? Do you know what I'm saying?
Yeah, of course.
Yeah, so obviously there's health issues that we'll probably talk about as we go along.
Obviously, it's
Like-
not right, is it? Like to just go up to a total stranger and say, "Oh, you shouldn't be eating that." I mean, I come from I'm Indian, right? And Indian
Really?
aunties, yeah, I am. Indian aunties are raw. They will just tell you, right? So, say you go to a wedding and you've put a bit of weight on,
Yeah.
they will come to you and say, "Oh," they'll even pinch you and say, "Oh, you put a bit of weight on." Like they will just tell you. They don't care, right? That is body shaming, isn't it? But if a close family member or a doctor or your personal trainer or whoever you're close to that you have that relationship with says to you that, look, I think you need to really address this situation. You're really starting to like put on extra weight. It's not good for your health. I think that is a conversation that needs to be had, isn't it?
I think that's the last thing you said there, when it becomes detrimental to your
The
health.
thing is, though, it depends on who you're talking to, because obviously, as you know, I've got quite a big family and they're all not very healthy. And I think my brother's around 45 stone.
Wow.
Right, he's huge. But I've never met
Did you
any...
say 45?
Yeah. He's like one of them people that he like can't move around much and stuff like that. He's big, right? Real big.
45 though?
Yeah.
It's a lot, isn't it?
Yeah.
That's...
He's one of he can't move and stuff like that. He can, but not very well.
Yeah.
You know when you see them people with like hands down and
Yeah,
stuff like
yeah,
that.
yeah.
But you've never met anyone so happy in your entire life. Like, he's so happy, and he owns a taxi company, so he's in his taxi all day, driving around, but like full of banter, loves life, and he's actually very happy the way he is. And I've obviously said to him many times, like, you need to lose some weight, lad. Do you know what I mean? But he doesn't want to. He's just happy. See what I'm saying? So some people are actually happy.
Do you think as a factor, like if you say to him, "Oh, lose weight," he might take that in a different way, where he probably it's not a motivational factor that I need to lose weight, and he'll end up just I enjoy myself, I enjoy my life, and indulge more. So therefore, like instead of taking and making a change to his lifestyle, he's thinking, "I'm happy the way I am, and I'm going to carry on doing it no matter what the repercussions are."
Well, he was told by the doctors if he didn't do something, he's only got a few years left to live. But I
That
know.
doesn't bother him.
I mean, I'm sure it does at some deeper level. Do you know what I mean? But I know at one point he tried to lose a little bit, so he came off the Red Bulls and sugary drinks and stuff. But he's still very, very big, and he's just happy.
Okay, so
What I'm trying to say is, how do you say that to someone who's...
relationship?
Yeah, he's got misses. Yeah.
Yeah, so
he's got loads of birds. Women love him because he's got the banter. He's just funny. I don't know how he does it, but he does it. Do you know what I mean? And he's just happy all the time, always cracking jokes. But how do you say to somebody like that, who I know is unhealthy for him to be that big, but he's happy?
Do you think he genuinely is happy? Though?
Yeah, he's my brother.
Really?
Yeah, of course.
Yeah.
Yeah.
Because I always wonder that. You know how you see like, and they say, "Oh, I'm happy the way I am." I always think, "Are you really?" Because I know I wouldn't be.
Yeah, but that's because of the type of person you are, though. Everyone's individual, aren't they? Some people
Yeah.
are actually quite happy like that.
Yeah.
And I'm a personal trainer. Obviously, this is what I do for my profession. And I've got a brother who's extremely overweight, who's been told I think he said 3 years left to live if he didn't do something about his health.
Wow.
And yet he's quite happy.
Yeah. And does he have like lots of health conditions then? Has he got diabetes?
I've never asked him, to be fair, because
Yeah.
he doesn't really talk about it much. But being that big, he's obviously got some health implications.
Okay, so here's a question then. Okay, so I mentioned it to you in the car, didn't I? That obviously, like, one of the biggest costs to the NHS is people who are overweight,
Yeah, yeah.
obese, okay? Because they all have, a lot of them have like diabetes, high cholesterol.
Yeah.
I mean, do you feel that that's fair to everybody else? That's like, obviously NHS is on its knees, literally, right? And then you've got people who say, well, I'm happy the way I am. But then it's a strain on the NHS because it is costing so much.
Yeah, but then you're asking the wrong question. If they cared that much about it, they would do something about the food.
I think it needs to stop.
The food system is what's called. You've got to look at it from this people's point of view, right? It's very difficult for people to eat healthy. Very difficult. If
think it is.
100%.
I don't know if I agree
Financially, with the work life, if you're a single mum or just a mum with kids, if you're on the road a lot, you go to any service station, you go to buy anything, and what's all around the till? Chocolate, sweets, crisps. It's all in the face of everybody. You go to anywhere, supermarket, meal deals, it's cereals,
Yeah.
bagels,
Deliveroo, the fact that
everything is so unhealthy for people.
Choice?
No.
Is it not a choice?
Yeah, obviously everybody has a choice at the end of the day, but the system is designed, it's against people. Do you know what I mean? You've got to make a conscious effort to look after yourself, and then you're classed as a weirdo. Like, people speak to us like we're the weirdos, but yet if you are unhealthy and you don't really do much and you're sitting on Xbox all day long having takeaways and going out every week and getting smashed, that's normal. But if you're in the gym looking after yourself, you're classed as a weirdo. Do you know what I mean? Like, why do you eat 6-7 meals a day, Paul? Why are you in the gym every day? Because I want to look after myself.
What are your thoughts on the NHS and?
Ooh. So it's, I agree with a lot of the things that Paul has said in terms of how obesogenic the environment is and how difficult it is to actually, how easy it is to just eat the wrong things because they're so easily available and they're everywhere.
Yeah.
Now, when it comes down to the topic of fat shaming or body shaming, as a clinician, and from my experience dealing with patients, it never helps with anything.
Yeah, I agree.
It doesn't help the patient, it doesn't help the clinician, it just makes things so much worse.
Yeah.
All right? So the tricky part of it is, where do you draw the balance, where you give in health information and health advice as a doctor that the patient can take and do something with it without feeling judged, without feeling bad about themselves.
Yeah.
Because it's very, very easy for these patients, when they get stigmatized or when they get body shamed,
Yeah.
to internalize it and develop, an eating disorder or develop mental health disease, depression, and anxiety, and actually makes things so much worse.
Because I think there's I think I read as well that mental health is higher for people who are overweight. And that all comes back to this body shaming, doesn't it? And I don't think anybody should be made to feel bad about how they look. I don't think
No, of
that's
course
right.
not.
We
Definitely
should
not.
be helping them and supporting them, shouldn't we?
So the other thing that I will say is, coming back to what you said earlier and some of the concerns that you expressed in terms of what is healthy, what is not healthy, shall we not strive for health? Well, let's try and maybe give a bit of a definition of what health is so that we can put that into context, okay? A lot of people, and a lot of doctors, actually, a lot of colleagues will think of health as the absence of disease. You go to a GP, they test you for diabetes, they test you for high blood pressure, etc. If you're not passing the markers for diabetes, you're not diabetic, you're healthy. Now, we know that disease doesn't develop like that. You don't wake one day and then you're all of a sudden diabetic. It builds up in the background over years, okay? So someone like myself, I see health as not just the absence of disease, but a state where someone is optimized, where people thrive, not just surviving, okay? Where you tap into the mental, physical, and emotional potential. Now, then you can bring this conversation back to obesity. And there's an argument to be made to say, okay, if health is a state of optimization, is a state of thriving, and a state of tapping into your true potential,
Yeah.
being obese and carrying this extra fat in your body with all the risks associated for developing a disease in the future, can someone argue that this is health? because you carry the inherent kind of risk of developing disease. Now, there is the other argument saying, all right, and Paul just tapped into it, saying, well, there is obese people who are actually quite healthy. They go to the doctor, they run all the blood tests, and then actually they're very, very healthy. Then there is people of normal BMI who actually very unhealthy, and it's this thing in the fitness industry and my line of work where it's the skinny fat.
Skinny fat, yeah.
Yes.
Yeah.
So now an argument that can be made in that case is it's all about measuring health in terms of risk.
Yeah.
All right. Can you get people who smoke that will not develop lung cancer, that will not develop COPD? You will. Yes. Does that make smoking in a population setting a healthy behavior because you get some people who just don't develop lung cancer? No. So as a doctor, I cannot sit here giving health advice and saying smoking is going to be all right because some people don't develop lung cancer, when I know that 80-90% of the people who do smoke will develop lung cancer. Now let's take it back to obesity. All right. Are obese people who are actually very, very healthy, very functional? Yes. In a population setting, do most obese people develop diabetes, develop high cholesterol, develop high blood pressure, increase the risk of strokes, increase the risk of cancer, increase the risk of heart attacks? Is that a reality? Yes. So as a doctor, I can tell my patients, you carry an elevated risk of developing a number of diseases in the future. Yes, you're here in my office and I can run the blood test and I can do all the things I need to be doing. And so yes, today you're healthy, but 5 years down the line, 10 years down the line, what is the risk of developing that? So shall we be doing something now to try and prevent any... So it's how really you see health.
Yeah.
Is it the absence of disease only, or is it a state of low risk and a state of thriving and a state of health optimization?
Yeah. Yes, it does.
Yeah, I agree with that.
That's a very good explanation.
Yeah, it's a very good. Yeah.
I feel like I just learned something there.
Yeah.
I think with that, at the end of the
That's
day,
the end of the podcast then.
at the end of the day, like you want people to strive, you want people to be active, you want things. I think with obese people, like you mentioned, your brother seems very happy. He may have some issues, and I think what you were trying to get at is there is a strain on the NHS and there's a cost.
But there is always.
There's a 6.1 billion cost to the NHS for people that are categorized as obese because of the health issues that come with it. Like you just mentioned, maybe not straight away, but eventually there will be an issue. And obviously it's predicted to be 9.7 billion by 2050 if we don't tackle it. Now, the way I see it is it should be tackled at an early age. I think we live in a society where people are working from home, so they're less active. They're sitting all day. They're not physically active. People are not taking up recreational sports. They are not doing things. Forget the gym itself. They are not going for walks. They're not going.
Children don't play outside anymore.
This is my next
Do you
point.
ever see children playing outside?
They want to play on Xbox.
Because they can't.
My kids were out all the time. I remember as a child.
But times have changed.
Times-
You let your kids...
It's not safe.
It's not, exactly.
No,
not
but
safe.
it's not safe. But people have now. I grew up in a 2-up, 2-down terrace. We didn't have a garden, right? But I was out on this. I was out. I came back in summer. Listen, I was 10 o'clock when it got dark. I'd come in, right?
I had to come home when the street lamps came on.
But the kids now, they have these beautiful homes. My sister's got a massive garden and a field behind it that they can play in. Do they go out? No, they're all on their Xboxes.
But then, Mum, it's
they
a
don't
different
want them-
society.
Yeah.
It's a different world today.
They used
but
to
that's
being
what
on.
I'm saying. They're not active anymore.
Yeah.
They don't want to play outside. Kids do not even talk to each other by just face to face. They do it all on TikTok or on their games that they play. That's how they communicate now.
Yeah.
It's true, isn't it? That children are not active anymore at all.
But it's not just children; it's adults as well. Because think about.
But like you're saying that it's to start from a young age. I mean, you look at yourself. From what age can you remember me dragging you to the gym? Even when they were off school or they were sick, I still had to go and do my class. They'd have to just sit in
That,
reception.
that was just free labour for you, wasn't it? Working
You'll be
for-
okay. I'll give them some Calpol. Just sit there for an hour. You'll be okay.
Yeah, like, but the thing is, I think it doesn't just help with children. I think it's adults as well. Like, working from home is a massive factor. Like, it has its benefits for some people, but the fact that you're sitting all day in a house, you're not physically active, you're not doing anything. The other thing is, like, you mentioned about junk food and groceries and stuff like that. Buying healthier food does
It's more
cost more.
expensive, yeah.
But at the same time, it's like junk food's so easily to get. You just go on Deliveroo and you don't even need to move. Like before, if you wanted to go get a chocolate bar, you'd actually make physically effort to go to the shop and pick up the chocolate bar. And by the time you've done that, you might even think, you know what, I don't really want the chocolate bar.
The thing is, when
But
it
you
comes
can do
down
it
to
by
the cost of the healthy food,
Yeah.
though, is what I find this really bizarre, and you hear it from a lot of clients, is once they get the meal plan, or you tell them the supplements you want to take, the diet and things like that, they always complain about the price. Food's expensive, right? Especially healthy food. But yet they'll spend so much money per month on a phone.
Yeah.
Or going out on a night out.
Yeah.
Or car finance. All
Yeah.
this shit that no one actually needs.
But that's their
It's a
priorities.
choice.
But they think that's going to make them
Yeah.
happier. But actually, if they stop wasting their money in other areas,
Yeah.
invest in themselves a bit more,
Yeah.
and start feeling better, they will realise that no amount of fashion, nothing will make
Yeah.
you feel as good as you're doing inside yourself.
Yeah, yeah.
But people, like, how much is an iPhone these days? Like, a
Probably
monthly
a grand.
contract.
I say that's what I'm trying to say to you. It's about choice. How many people complain about a gym membership?
Yeah.
Say gym membership is £50, right? You break that down per day. How much does that work out to? £50 divided over
30 days.
30 days.
125, isn't it?
Yeah, okay, so £1.25 a day, right? But how many people will happily go out for a dessert or go to a, you know, I don't know, McDonald's or wherever they go? It's not cheap.
Yeah, but you're missing the point. I understand where you're coming from, but for them, it's effort to come to the gym, but it's little effort to drive to McDonald's for a drive-through or order it on the app because it's easy and accessible.
But don't you
Being
think-
healthy and fitness takes work. It takes effort. Ordering food and simply eating or eating your pain away or enjoying life, it takes little effort. It's enjoyment. Whilst
Yeah, to be
we
in shape,
enjoy-
you've got to put the work in.
We enjoy it, right? You enjoy going to the gym, right?
Yeah.
Did you say you enjoy going to the gym?
I love it, yeah.
You
Yeah.
enjoy the gym. I enjoy the gym. I enjoy sports. But there's people out there, we're a very small population where they've never enjoyed it. They've never had the experience where it's fun to them. It's a chore.
Yeah.
So whilst eating is not a chore, it's simple.
It is for me. I'm
For
tired of eating.
you're different. You're at a different level.
Your
Sick of
1,000
eating.
meals a
7,
day.
8 meals a day or whatever it is.
Sick of eating, man.
Yeah, but no, like, okay, then, like, so here's a question then. So we've got this this pill that's come out now, this fat loss pill, right? So that's a quick fix. For me, I feel like that's like a quick fix, right? And I was speaking to a pharmacist that comes to the gym, and I was asking his opinion on it. And he said, yeah, it works, it's good, whatever. But he said some people, like, how long, like, you're not teaching these people to live a healthy lifestyle. So you're just giving them this pill and they're going to lose weight. But they can't take this pill for the rest of their life, right? So when they come off it, what's going to happen? They're just going to pile all that weight back on again. You've not educated them or encouraged them to live a healthy lifestyle. So to exercise. Exercise doesn't always mean having to get a gym membership or go to the gym. It could just simply be walking, swimming, a sport. It could be anything, right? Cycling. There's lots of things. You don't have to go to the gym, yeah? And then eating healthy. Okay, even if you just cut out, just say, we're not saying to people that completely change the way you eat and you've
But
got to
follow
eat
a-
chicken and broccoli
yeah,
every
follow a
day,
guide.
right? No, but just cut out some of the junk food that you're eating, take away the crisps, the chocolate, just make some lifestyle changes. Is that not more important?
Do you guys remember the Eat Well guide, Clay?
Like,
So inaccurate.
So inaccurate. See what I mean?
inaccurate, yeah.
But this is what kids are taught.
yeah.
Yeah,
But
because
That's what they're
going
taught.
back to
So
the pill,
where-
what do you think about this, the fat loss pill? Like, what's your thoughts?
So there is so many points you touched there.
Yeah.
But start with the easier ones. 80-20 rule, yes. When you tell people you have to cut down everything from your diet to lose weight and you just focus on salads and greens, etc., the expectation of being 100% right every time is the biggest kind of almost like you're set up to fail.
Yeah, it's
Yeah?
not going to work, is it?
No. So
Yeah.
working on an 80-20 rule where you
Yeah.
say, okay, try and keep your diet 80%, eating the nutritious,
Yeah.
kind of whole food,
Yeah.
etc. And then the 20%, be more relaxed with it.
Yeah.
Okay?
Yeah.
Eat that sugar if you want to. Okay? That's one. The second point you touched on that was really, really important was the daily activity versus the exercise, the structured gym kind of exercise. So research has shown us that what counts more for weight loss is the daily activity. So being out and about, taking the stairs, walking instead of, taking the bus, this constant movement during the day is far, far more important than the 1 hour you're gonna spend in the gym.
100%.
Okay, so if you're not moving during the day and then you go to the gym for an hour, but otherwise you're just sitting on the sofa watching Netflix, that will not give you the weight loss results that we want. All right, so that's two. Now you're talking about weight loss medications. So very, very popular, Saxenda, Ozempic, the pill now with which is the same medication but in a pill kind of format. As a clinician, it's interesting because you have people who have tried everything. All right, they're going from diet to diet. They lose weight, they put the weight back on, and they spend years and years and years in this fluctuation of their weight. But they're trying. Okay, they go, the exercise. But then you bring in things like Paul has said, the obesogenic environment. You bring in genetics into it. You bring in hormonal health into it, which you don't have that much control over, etc. So there are things internally from a physiology perspective that you don't have that much control. All right, that might cause you to put on weight. So as a doctor, having a patient like this who is engaged with the lifestyle changes, okay, but they are not seeing results, that's an indication for me to start on medication, okay? And I do consider medications a strong, strong tool in the toolkit of a doctor. Now, the point that you're making is, okay, every medication comes with side effects. It's not easy to put someone on medication. When do you stop the medication? It will be much easier to stop a medication on a patient that works on the lifestyle and they just need that extra push for a small amount of time to lose their weight and see the results and then continue with the lifestyle. It's much easier to take those people off the medications. It's much, much, much harder when you have a patient that they are the convenience kind of patient where they don't want to implement lifestyle, they don't care about the food, the exercise, their sleep, their smoking, the alcohol, they just don't care about that. But they come to take the medication as the solution to all their problems.
Yeah.
It doesn't work like that. In those patients, would they lose weight? Maybe. Would they sustainably lose weight? Probably much less chance of that. Will they experience much more side effects from the medication? Most likely. So it's where you meet each patient, in what phase they are, their mindset, the effort they put on their health to make a decision on let's medicate, let's not medicate.
Yeah.
But I'm not against medications, and if anything, a lot of the times medication is the right choice for a patient.
Yeah.
Is how you combine it with lifestyle.
Yeah. So I think maybe there should be a caveat then that if we give you this, you still have to then make certain changes in your lifestyle.
So it's interesting. As a doctor, I cannot say that.
Yeah.
Yeah, I cannot bribe a patient and say I will only give you the medication if you demonstrate to me that you're gonna engage with lifestyle. All right.
Why not?
It's just not ethical enough.
Okay.
Really?
Yeah.
Because you're taking away their rights.
So it's almost like denying them treatment that they need. Reduces their risk of developing diseases.
So it's like somebody who, say, smokes and has lung cancer. You refuse to treat them if they continue smoking. same kind of.
So an area of medicine that happens, interesting enough, is the organ transplant area. You can deny a patient an organ transplant if you're not convinced that they will stop smoking, just because of that liver can go to someone else.
Yeah.
So that's an area of medicine that works a little bit differently. But in most areas of medicine, you cannot deny treatment to a patient that you know it will reduce their risk just purely on, you advise the patient and you tell me you need to be doing this and this and this, and that's how, you know, it will get much, much better results from the medication if you engage with the lifestyle and work with the patient to understand all these concepts and work with the patient trying to implement.
Yeah.
But I cannot come to a patient purely say, you know, they cannot choose, they cannot force the hand of a doctor to prescribe them the medications. That cannot happen either. They can deny medications, but they cannot choose medications. So it's always how you collaborate with your doctor.
Every
Yeah.
situation will be different.
Yeah,
isn't
everybody's
it?
different,
How you
aren't they?
collaborate,
Yeah. I mean, it's interesting, isn't it?
Yeah.
Yeah.
But don't you think like the food industry is against everyone though, because of that?
Yeah, very much so.
Like the whole grain situation. Like everyone knows whole grains are bad for you, but it's promoted everywhere.
Yeah, cereals.
Yeah.
Like,
Whole grains. Wasn't the whole grains done by the US farmers or something? Pretty sure I read something like that. Whole grains are not actually healthy for you, are they?
So
And you shouldn't eat
I
oats.
might not recall my historical facts properly here, but if I'm not mistaken, that industry developed very, very strongly after the World War II, I believe it was,
Yeah.
where they have a massive, you know, they didn't have the food to feed people. So that was an easy kind of way to actually feed people.
Yeah. But they're not actually healthy for you. Like we shouldn't eat
But-
oats and stuff like that.
Yeah.
But I eat oats every day.
Yeah, I eat oats every day.
They're not good for you, though, are they?
Well, you know,
It's
in my-
horse food, isn't it?
As you know, in my clinic, Paul, we go deep into each patient. So we do DNA, epigenetics testing, biochemical testing, something that works for one patient.
Yeah, it will not work,
Will not
yeah.
work for another.
Yeah.
So you have to focus on the biochemistry, the physiology of the patient you have in front of you, because oats might be really, really bad for your health, and
Your
for
body might
Adil,
not be able to
yeah.
digest it very well.
Yeah.
Yeah, but then for some it might work really well. It's true.
But I'm just talking
But
on
my-
the general scale, though. They push foods
Yeah.
that are not healthy for you.
Yeah.
I guess so,
Yeah,
but
but there's
my
sugar
motto.
in everything.
Yeah,
Even low-fat food, something that's marketed as healthy or low-fat. If you look at the ingredients, it'll have sugar added to it. A sugar
Take Diet Coke,
is
for
more
example.
addictive than cocaine. We are as a
Sugar-
society, we are addicted to sugar, and that is the devil. Like that is the worst thing.
Sugar causes every disease.
Yeah.
Yeah.
Do you know what I mean?
But-
But my motto is like take
Pardon?
everything in moderation, innit? Like
Yeah.
if
Yeah,
you have
100%.
too much of something, it's going to be detrimental to you. If you have too little of something, it's going to be detrimental to you.
Yeah.
Like
Like body
You-
fat.
yeah, body fat, yeah. But I think like with sugar, like I think the government are trying to cut down on it. Obviously, I can't speak for the government, but like introducing a sugar, well, they've introduced a sugar
Sugar
tax,
tax,
so the
yeah.
No, the thing is, though,
costs more, doesn't
the
it?
thing is, that all they've done is charge people more for having sugar things.
Yeah, but the whole
they haven't
reason-
done
the-
anything good at
yeah,
all.
but the whole reason for that
Is
is
to
so
make
people,
money.
yeah, to make
But
money.
that's
That's it.
But at the end of the day, people are spending more, so they might feel more like, do I really want to spend that extra money on that?
The way I see it, people are unhealthy for a reason. And sometimes it's not their fault. And I'd say most of the time it's not their fault. It's what they're shown.
Yeah, I agree with you.
And
Yeah, it's
everything
what
is
you-
stacked
yeah.
against them.
I mean, it's
the whole
it starts
food
from,
industry
like,
is
yeah.
a shambles. The whole food industry.
And it's what you grow up around as well.
If you look at like my granddad, our generation, your parents and stuff, look at how healthy they was compared to today
Everything,
people.
the food was home cooked. There was no such
Exactly.
thing as takeaways.
There was no all
None
this
of the-
artificial flavour. Like they're trying to ban, was it the red R40 colouring, aren't they? They want some Doritos. You shouldn't. Have you ever heard about that?
No.
So the red filled food coloring that they use in Doritos is banned in so many countries, and they're trying to get banned here in the UK because of what it causes all these issues to people.
Yeah.
But it's in everything.
Yeah.
Do
But there's
you know
so
what I mean?
many foods like that.
Yeah, but they're all bad for you. But you go back like
Yeah.
a few generations ago,
People don't eat.
autism
the-
wasn't such a
yeah.
thing.
Yeah.
Do you know what I mean? Everyone's got autism, ADHD,
Yeah.
all these problems. It's because of all this
Mental health,
food
yeah.
stuff that they're putting in all the food
Yeah.
that I personally believe is causing all these issues for
Yeah.
people.
Yeah.
Do you know what I
agree.
mean?
I mean, we touched on this earlier. You're from Cyprus, and you were just saying that, like, you have a very different mentality when it comes to, like, food. And I know that when I go to Europe and that, you can see that the food is so much healthier. There's not as many fast food type takeaways. and-
Yeah, I think people from where I grew up, I will always, see my grandma, my mother, families are big that they stick together, etc. So they're more inclined to cook from fresh, and everything is home cooked, using whole foods, highly nutritious foods. The Mediterranean diet in Cyprus is
Yeah.
quite popular one. It's when it becomes more westernized,
Yeah.
when everything is the
Yeah.
takeaway. And
Yeah.
I come back to Adil's point, which I think is very, very important when it comes down to health, is the convenience.
Yeah.
People like to be convenient. They don't put that much emphasis and focus on health per se. They put more emphasis on how they can be convenient. But Adil is very, very right. Health requires effort.
Yeah.
So if you could, it's important for people. Yes, it's not like they don't want to be healthy. It's just they don't want to put the effort in. So if they have the choice, if you take this pill, you'll be optimally healthy. Everyone will take it.
Yeah.
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 If you tell them you exercise, give them a training program, and if you exercise, you'll be optimally healthy, they won't touch it, just because of the effort.
Yeah.
So it's the other thing that research has shown us, and as a clinician, is something I'm always mindful for, and probably guys from you as fitness and health kind of experts with your clients. It's one thing to give the information to the patient. Okay, here's the information, here's the advice, and it's another thing to actually help them to implement.
Yeah.
And that's where the results and the difference is made.
Yeah.
Okay? We know for a fact as doctors, if we give the health advice, it's not enough.
Yeah.
It's just not gonna stick.
Yeah.
Okay? From the 10 things that we said to the patients, 1 or 2 will stick.
Yeah.
The rest will just fly out of the window.
Yeah.
If the patient has access to a medical clinic with a medical team that actually follows them up, tells them how to do things, keeps them accountable, etc., that's where things start happening.
Yeah. It's baby steps, isn't it? I mean, I think, like, how much respect do we have for someone? When you see the transformations at the gym, when somebody's overweight, come in, got a PT or just train themselves, they come in regularly, they've changed their lifestyle, and then they post a body transformation.
Yeah.
How much do we all clap?
Yeah.
Like how many likes do we get?
Yeah.
Everybody comments, because we know
The hard work
how
it's took.
much work it's taken,
Yeah.
how much dedication. And it's not easy, let's face it, right? For somebody that is a bit overweight or obese to walk into a gym environment, it must be so hard.
Oh, yeah.
We try and encourage it as much as possible. You'll tell your clients, don't worry. You'll be
I always say, don't worry, I'll look after you.
I'll look after you, yeah. But they must be so scared, and it's horrible, isn't it?
And it must be horrible for them. They probably are body shamed a little
And then
bit when they walk in.
when somebody then body shames them,
Oh, yeah.
like, I think that's like it's
It's horrible. It's not nice, yeah.
So demoralizing, isn't it?
Like you have to look a certain way to be
To be able
respected,
to, or to go
respected in
to the gym,
society.
yeah.
It's not
They're
right.
there for the same reason
it's
as
not
everyone
right.
else.
It's not right at all.
So I think that,
Everyone should be welcome. Everyone should be able to walk in without
Yeah.
being looked at in a certain way.
The
or
thing is, though,
felt
a
that
lot
way.
of people, when they come into the gym, that's their assumption of what it's like.
yes,
And it's not the
they
reality.
think that it's full of like
Because
fit people.
most
yeah.
people in the gym are there because of the same reasons.
Yeah.
So they're not looking at other people.
No.
They're more concerned that people are looking at them.
No, and Paul,
Do you know what I mean?
come on, you guys, all of you. The gym's full of people who've got body dysmorphia. We've talked
Yeah.
about this before. Even the
course.
fittest people there look at themselves and think, oh, I'm fat, or oh, I'm not big enough, or I look like... So there's nothing to say that bodybuilders and athletes are super healthy and all like...
Bodybuilders are probably the most unhealthiest.
Yeah.
Do you know what I mean?
Me and Paul were talking about this in the car.
I'm probably one of the most unhealthiest people in there. Do you know what I mean?
Yeah.
Like, it doesn't matter. Like you're putting your body through so much strain and thing. You're not it's not healthy what they do.
No, it's
but they
not.
do it because it's their goal and the thing.
What's your thoughts on that? What do you think of bodybuilders?
So
do you think that they
Be
are...
gentle.
Be honest.
So bodybuilding
I might
is,
talk about body shaming, yeah?
bodybuilding is a complicated sport. Bodybuilders have to push their cells and their physique to such an extreme,
Yeah.
that it can be very detrimental to their health. It just builds, the body doesn't understand. When you're stressed because you're getting a divorce, or when you're stressed because you don't have good relationships in your work, or you're stressed because you don't eat right, or you don't sleep right, or you're stressed because you exercise too much, the body, is not really good in distinguishing between. The end result is that cortisol spike, okay, from all these different stressors. So in the case of a bodybuilder, they're stressing themselves because they're trying to break those muscle fibers and build them back up, all right, and push themselves to that level in terms of their sport. That elevates cortisol. That's a lot of stress for a body, and cortisol we can go have a whole podcast talking about cortisol, but if they're not able to recover properly, then the damage they potentially do to their bodies is just not healthy. So for them, it's really, really important to be in an anabolic state, because they need to be built in muscle, but also recover.
Yeah.
The recovery protocol should be as strict as their anabolic protocol.
Yeah.
Just to counterbalance the damage that they do to their body.
What do you think is the best thing in recovery? Sleep?
Well, sleep is important.
Because I sleep a lot when I
100%.
can.
Sleep, that is, massage is really good. When you're beating, those muscles, then recovering the muscles with a deep tissue massage. Supplements are important to
Magnesium is
recover.
good, isn't it?
What
Magnesium
supplements
reduces
would you
cortisol, doesn't it?
Oh my God, let's not go into that conversation.
There's too many. Okay, let me ask you something then. Is there such a thing as, well, I think you've already just said it, but overtraining then?
Yeah, 100%.
Yeah.
And overtraining is probably as, health damaging as the other end.
What would you consider as overtraining?
Surely that's independent to each individual,
Would
yeah?
it?
Overtraining is, it comes down to not be able to recover.
Yeah. So if
And
you just-
your exercise
So I
physiology.
was just going to say that. So one
Yeah.
of the things I was looking at it was one of the effects of body shaming, and it is actually excessive exercising. So excessive exercising, obviously your body needs to recover. People become obsessed with it, but then it can also lead to injury. So going that extra mile when your body can physically not go there, it's subjective to every single person. I might be able to run more than John, for example, or I might be able to do more exercise than John, but it's what your body is capable of doing and pushing that body to that limit. So this moment, let's say I finish a workout session, I'm completely tired, like I'm depleted, but I'm so obsessed with how I look, or I want to look a certain way, and I carry on going. That is overtraining, and that is not allowing your body to recover.
We had this conversation, didn't we?
And I
John?
think it's important to listen to your body.
Yeah,
I think that's one
Yeah.
thing.
So
But it's subjective. isn't it?
So what happens in that state is your metabolism runs in a completely different gear.
Yeah.
Your hormonal status is just almost like on steroids.
Yeah.
All right, which you can actually deplete your hormones, your testosterone, your growth hormones, etc., by overtraining. And you run on a hormone depletion kind of state, which obviously from a health perspective, that's not good. Your diet needs to be so on point when you're someone like Paul and you're a bodybuilder. Everything that you expend.
It's that energy
Yeah,
balance.
your
isn't it?
energy balance. You have to get it back in,
Yeah.
but in such a fine balance that you're built in muscle and you're not built in fat.
Yeah, that's right. Yeah,
So it's very, very fine there.
and that's when the science comes into it, and then it gets a bit complicated. But for everyday person, I think it's just listening to your body, and then having enough calories, and then having that energy output that's balanced. So you're doing enough, and you listen to your body.
So if
and you
you're,
recover.
just say you've trained one day and then the next day you feel exhausted, would you say that it's wise to just take that day off rather than think, no, I have to train because I train on this day? Like I train back on this day, I train chest on this day.
You need to pay attention to what your body is telling you, all right? And be able to translate those signals that the body is giving you. Now, technology has moved loads in this industry. You can wear a ring or you can wear a wristband and it will tell you exactly your recovery score. It will tell you your heart rate variability. It will tell you so many information. It will tell you how much sleep you got last night, whether that was deep sleep.
Yeah.
And you know, there's so much information that you can actually make decisions based on the data that the body's giving you.
Yeah.
Because now we're good in capturing that data.
Yeah, yeah.
So it's less of a guesswork and it's more like, okay, what the data, what the numbers show. When I feel like my body needs to recover and I have my recovery report from my sleep telling me I need to recover, you have enough indication that you have enough evidence that this is a recovery day.
Yeah.
Go to the sauna, go do some, core thermogenesis, etc. All those should be in a good recovery period.
I don't know about you guys, but for me, it's actually harder to take a day off from training.
See, I'm not too. I used to be like that, but see now, like I listen to myself a lot. If I'm tired, I'm not training.
So can I ask you, when you're in prep, the last 2 weeks is the hardest normally, right?
Yeah.
So if you're completely out of it and you need to follow the plan, are you going to stop that and recover, or are you going to go?
That's different.
It's not different though, because you're not listening to your body. You're trying to reach a goal because you want to look a certain way.
That's different because you're doing a show. But I guess if I got to the point, so not last time I did the show before, I ended up in hospital the night before I was meant to be on stage.
Really?
My old coach, he dehydrated me that bad.
Yeah.
I ended up on a drip in hospital for 3 days.
Yeah.
Just because I was simply dehydrated. But I listened to what he said.
Yeah.
But we learn from that. I think going forward, obviously the coach I'm with now, if I said to him, look, I'm done, he would listen, but he'd probably still make me do it.
Yeah.
You know what I mean?
That's interesting, isn't it? Because for me...
That's different though, isn't it? That's different to the other sport. You do a show.
It was a very extreme situation.
Do you know what I mean? But if I was just training for myself...
But it is harder for us to take a day off, right? I mean, I want to be the same as I was 20 years ago. You know, I'm trying to fight aging.
You're old now.
Sorry. I'm trying to fight aging. You say my body's telling me you're tired, rest, but I want to carry on, and that's not good either, is it?
Well, I think let's leave the personal trainers out of this equation because it's such a special group.
Yeah,
like it's a
very
sport.
small, yeah.
You know,
The
it's
bodybuilders.
the bodybuilders. Yeah, sorry, not bodybuilders. It's elite athletes.
Yeah.
Okay, it's completely different population.
They're
the
a
rules
class of their own.
the rules don't apply to them. The rules that apply to the rest of us are not the same.
Yeah.
All right. So it's a special attention kind of population that let's not compare them with the general population. It's different rules. Sorry, your question was about listening to your body more as you're aging.
Yeah. I answered my own question.
Answer yourself there.
But it is, but this is like we're talking about extremes, aren't we? So when we talk about obesity and people who don't train and they eat really like unhealthy foods and they just make and then you've got the other extreme where people who overtrain and they're obsessed with how they look and they're with what they eat, almost to the point that it does become a bit of an eating disorder because they're just so focused on like measuring their food and they become obsessed with it. So you've got now two extremes here. It's trying to find that balance, isn't it, and bring it.
Yeah, but I think you can't have a balance if you're trying to be something.
Yeah,
so a bodybuilder, you can't find
a... about just bodybuilders. There is a lot of people in the gym who I know, who I speak to, have got eating disorders and will spend hours and hours on just the treadmill because they want to be skinny, they want to lose weight.
Yeah, but that's I don't think that's an eating. That's a lack of knowledge of how to lose body fat.
Yeah, I think within our remit within the fitness industry and people that come to the gym, they're all there to reach a goal. Either that might be 6 weeks before their wedding. Or
they might extreme diets, before holiday,
that you need to lose weight by this certain day, etc.
But
I think as a holistic approach for everyone going forward, they need to realize that they need to listen to their body. They need to realize taking a step and changes in their life is going to take time, rather than the extreme cases where you've been told you're slightly overweight and then you're like, right, I need to lose weight. And then you become a bit obsessed with it, and then that's when you don't listen to your body, and then you start to become fatigued, and then you put yourself through more harm than actually improvement. It's just that balance.
It's a tricky one because, I know people who've got eating disorders, a lot of them have been overweight, and something's triggered in them, and they've just like literally said, that's it, I'm going to lose weight. And then for the rest of their life, they have an eating disorder because they never ever want to go back to being overweight again. That's like...
Then again, it's just down to the lack of education, isn't it? On how,
Yeah.
100%. It's not hard to lose body fat. It's actually really easy. Do you know what I mean? You just got to eat less and move more. It's literally that simple. The hard thing is adhering to that every day and making it part of your lifestyle.
So do you think
changing
that...
your
People
habit.
think within 12 weeks they sign up to a personal trainer, they think, oh, it's all going to change.
Yeah.
Because I've now got a personal trainer, it's all going to change, going to lose the weight. And they get a few months into it and nothing's really happening because they're the ones that need to do the work. Do you know what I mean?
And it takes time.
It does.
But so do you think that there's just not enough education out there then? Do you think that we are not, as a society, that our government, the schools, they're just not giving us the right education around exercise, nutrition, health?
So I got.
What's your thoughts on that? Go on,
Go on.
sorry.
So I just had one quick stat. So 1 in 3 children leave primary school overweight or obese, and I think schools do need to do more. So they need to be taught. But then those students or those kids, where do they learn from? They learn from their parents.
Yeah.
So are they educated? So do we need to educate a whole society and start from scratch? Because you can start from school, and it can start building up, and you can teach them the importance. But when they go home, is what are they eating? Mom and dad saying,
What's in
right,
their packed
go
lunch?
play PlayStation rather than go play football.
I still blame the food industry.
Yeah.
Do you really?
Yeah.
Can you really put it all on the food industry?
100%, I think it's designed that way.
Like,
100%.
Made a good, like, was it you that said? But like, I remember.
I think people have a choice though.
As a child, I remember always having home cooked food. There was no such thing as a takeaway.
Yeah, but
There was no takeaways.
But you got to remember now, though, today, mum and dad both have to work. Back when I was a kid, my mum
Yeah,
didn't need to
mum was
work.
at home, yeah.
She was at home raising the kids. That's why kids are the way they are today, because they're not being raised by their parents. So when you got both parents working, who's feeding the kids? Who's looking after the kids? Who's cooking for the kids? And one of the biggest things for child development is meal times with your family,
Yeah.
which they don't no longer get.
No.
Do you know what I mean? And I think the whole system, the whole society shifted, and it's making it very difficult for people to become families and to eat well like we used to do back when I was a kid.
Yeah.
The whole system's changed, and I genuinely believe it's designed to be like that because the pharmaceutical industry make billions from people being ill. Because if they cared that much, they would ban cigarettes, they would ban alcohol, they wouldn't produce all this food that they know is very unhealthy for us.
Yeah.
You know, you wouldn't have you didn't have supermarkets back in the day. You go to the butcher to get your meat, you go to the veg shop to get your veg.
Yeah.
Now everything's all processed, manufactured.
processed,
and it's
yeah.
what's causing all these illnesses because we're not designed to digest all these artificial
Even
foods.
vegetables, and if you're not buying organic, how healthy is it really? I mean,
Well, you're better off to buy frozen veg.
it's crazy, isn't it?
Yeah.
I mean,
Frozen veg and frozen fruit's healthier than fresh fruit and veg. Because when fruit is sitting out on the shelves in the supermarket, it ripens, which brings out more sugar. They spray it with loads of things I don't know what they spray it with, but keeps it preserved for longer, all this kind of stuff. When you buy frozen berries, there's less sugar in them because they're frozen there and then. Same with the vegetables.
I hear what you're saying, Paul, but should we not be
Yes, we
taking
should do a massive
responsibility
war on...
for our own health?
You
Like,
can,
is
but how hard is
I agree
it?
with you.
But
I
how
agree
hard
with
is
you,
how hard is it though?
But
I think the
there's
food
a
industry are a
KFC
factor.
There's a KFC on my route home every day. I see queues outside there, right?
Right.
But does that mean to say that I'm going to stop at the KFC? The KFC makes me feel sick. I will never touch KFC, right? It's a choice. I don't want to eat that kind of food. Growing up, my children, I worked. I'm a businesswoman. I've always been busy, but I've always made home-cooked food.
But again, you're looking at it from just your perspective. Not
That's
everyone's like you.
your habit. Your habit.
Not
is
everyone's
not
like
to
you.
go have fast food.
You got to look at it from the general public that are working their asses off, slaving away all day long, and they need something to eat. They've not even thought about eating for the past 5 hours. They're driving home, I'll go to McDonald's. Do you know what I mean? It's there. It's made that
Do
way.
you think that there should be more convenient,
People should
healthy
be working less, okay, to spend time at home, and people should be having that family time, and we should get rid of all this processed, manufactured food that we do not eat. We don't need in our systems, and you watch the health in everybody start coming back to
So
the
okay,
was.
so then the council should not be giving out so many planning permissions for all these burger and fast food places that keep.
We don't
popping
need
up.
them.
Everywhere you go, there's a new one opening up. Go to Evington Road. How many burger places
Yeah,
are there? I
but-
could count like 10. Right. So I don't know. Like, what's your thoughts as a doctor? What do you think? It's so complex.
Well, doctors aren't trained on nutrition, are they?
Unless you go and retrain into lifestyle medicine
Yeah.
and specialize.
So,
in
okay,
that.
so how nutrition is the most important thing. If your body is full of minerals and vitamins, you will not build it. You won't get diseases at all. Okay, if you look after yourself through proper nutrition. So we know that. So
That's
why
an overstatement, but yeah, carry on.
it's
going with
almost.
that
But why are doctors not trained in nutrition? When surely that should be the first thing that they should look at to treat a patient.
I think that's a bit unfair though. Like, I don't
It's
think,
not.
I
You
think,
go to a doctor, they give you tablets.
It's because so a lot of us actually leave the profession because of that reality. So we go into medicine, train as doctors, learn how to practice medicine properly. Then we go outside in the real world and practice the profession, and the reality is massively different.
Yeah.
Because when you're given 8 minutes in a GP surgery to see a patient, that they come with 10 different problems, all right? And
You're only allowed to tackle one.
And as a doctor, you cannot ignore the problems. If someone comes with a systolic blood pressure of 200 plus, and you know that in the next 1 week they're running a risk of getting heart attack or a stroke, you cannot just say, okay, let's wait, let's do this diet plan and this exercise to bring your blood pressure down. No, because you know that's the long-term kind of plan. You need to give the medication to bring that blood pressure down so that the patient doesn't get a stroke in the next 1 week, all right? Now, when they're coming with another 5 problems, not just the blood pressure, and you're only given 8 minutes, then you can imagine you have the professional kind of ethical responsibility to try and do something about it when you don't have the time, though.
Okay.
So here's a medication for this, here's a medication for that, here's a medication for that. You know, doctors don't have the time, and we almost like condition the patients as well that way in terms of, okay, here's the easy option, here's the medication to manage the symptoms, and then we condition the patients to want to come to the doctors to just get medications. When you try and have a conversation with the patient about lifestyle, it becomes a marathon. It becomes like, you know, how do you implement it? How do you monitor that? I had a patient recently that I said, you know, smoking 40 cigarettes a day. We've done all the tests available, angiograms, blood tests, everything. Okay, he doesn't have a heart attack, all right? Is he at the risk of heart attack? Yes, he's presenting with chest pains. So the advice was then, okay, we've done all the tests, we repeatedly done all those tests, and you don't have a heart attack at the moment, but why don't we have a conversation about reducing your cigarette smoking so that you don't get all these chest pains? The response from the patient was quite funny, was, so you're not gonna give me a medication? I said, there is no medication at the moment to treat anything, but I think we should be reducing the smoking. And the response was, you're not a real doctor. I want a real doctor who can give me medication.
Really?
Oh, wow.
So you can see how
Yeah.
difficult. I have colleagues, of course now I work more in private, so it's a little bit different from the NHS. But I have colleagues, GPs in the NHS, that even trying to implement a simple grocery list, yes, of healthy foods to their patients, it becomes such an impossible task.
Wow.
So it's different. It comes back to what we're discussing as well in today. You know, when you are a mother of 3, and you work in 3 jobs,
Yeah.
you don't know if you can feed your kids. You don't know if you're gonna even have money to pay the bills and
Yeah.
keep a roof over your family. You know, does health become priority for that woman? No.
No.
Survival
Survival.
becomes priority.
Yeah.
Yeah.
And when you extend that and see that the most of the population is actually in a survival mode,
Yeah.
you can see how health is not a priority.
Yeah.
We deal with patients who are financially more affluent, all right? They spend their whole lives building their businesses and becoming unhealthy in the process because of the stress, etc., etc. And once they have their finances sorted because they build up their businesses, health becomes their
Yeah.
first priority.
Yeah.
How do I now become healthy and maintain my health for the long run? All
Yeah,
right.
yeah.
But can you see the you know, the association between finances and health
Yeah. Yeah.
Yeah.
and priorities.
Yeah.
So it's very complex. It's
It
very
is.
complex. We live in an environment that it pushes us to be obese.
Yeah.
The food choices that
Yeah,
we discussed,
yeah.
the fact that the finances that most people don't have, the stress,
Yeah.
the families, the
Yeah.
kids, the million jobs that someone needs to do, it's a lot.
Yeah.
So everything works against us to become obese and unhealthy in the process. But, you know, life is hard. You just have to choose your heart.
Yeah.
Yeah.
And you know that if you continue like that and not paying attention to your health, you know,
You're only going to
you're only going to get
further
worse.
down the line.
All right? So putting effort into health is always a good option.
Yeah.
How you do that now becomes tricky. You know, your environment, are you part of a gym with personal trainers that understand health, understand nutrition, understand exercise, understand life itself, that can help you and push
Navigate
you meet
through
your
that,
goals,
yeah.
etc. Are you part of a medical team that can test you properly, show you the data, show you where you're going wrong, help you either with lifestyle or medications to push you to the healthy state of things? You know, do you have access to a gym? Do you have access to a medical team?
Yeah.
All these things are important, and all this is complicated, but the answer is not do nothing.
Yeah.
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 That's never the answer. The answer
Yeah.
is, what can I do to work on my health?
And do you feel that maybe the NHS, I think we've gone over, but
No.
5 minutes. Do you think that the NHS needs to have more funding so that they can have dietitians, nutritionists? Maybe they can. I know that they do give gym memberships they do give out free gym memberships. To
Funding
people.
and staffing is the
Yeah.
biggest issue of the
Yeah.
NHS. Okay, they don't
So
have the
you
money,
can
they
help
don't have the
these
staff.
people, rather than, like you said, just giving them a pill or saying you need to lose weight, but then they haven't got a clue what to
Well,
do.
We work in a healthcare system where the disease is so prevalent in the population, all right, that all the time and resources you have is managing that disease with medications,
Yeah.
all right? Going a step back and dealing with root causes, dealing with the obesity so that you don't develop preventative healthcare,
Yeah.
there is no funding, there is no money, and there is no staff to do that.
Yeah.
There is no time.
Yeah.
All right. When you're overloaded with just try to treat diseases, which is the emergency kind of situation, then you have no time and resources for actual proper medicine,
yeah.
which is why a lot of
To
doctors leave the
prevent it,
profession.
yeah.
Because we move into that profession to try and do that.
Yeah.
How do we keep patients healthy? How do we do preventative healthcare? How do we see health as this idea of thriving, not
Yeah.
just surviving? And then we're thrown into a system that is all about surviving.
Yeah. Yeah.
And we want to deal with root causes, but we don't have the resources at the time.
And the time.
So a lot of people, doctors and nurses are a few of the very, very unhealthy populations actually because of the stress
Yeah.
and this unsatisfaction of actually delivering health the way we're trained to do so.
Yeah.
But
Wow, that was
I learned a
so
lot.
interesting. I learned so
learned a
much.
lot.
Yeah. I think I hope you guys have enjoyed it. I think we need to get Dr. Dimi on again.
pleasure.
If you have any, I think what we can do next time is you can ask us any questions that we can put to the doctor, and I think we'll need to get him back on again. But yeah, thank you guys. That was. I think we went from body shaming to. But
the
just-
NHS.
yeah. And I think it's true. I think like Paul summed it up. I think that where people are set up to fail, aren't they?
Yeah,
Really are.
100%.
Yeah. But we will keep doing our bit, and obviously, like I said, as a gym, we and my personal trainers and all of us, we encourage everyone to come to the gym. You know, we're all about health. It doesn't matter what size or shape or whatever you are. We don't care. As long as you want to get healthy and live a healthy lifestyle, then we are here to help and support you. And, you know, there's nobody's judging you. Our gym, everybody's so accepting
Yeah.
and supportive, and that's what we stand by all the time. But thank you, Dr.
Thank
Dimi.
you.
That was, really interesting. I could listen to you all day.
He's got a way of talking, hasn't
Yeah,
he? I was
yeah.
just sitting here dazed listening.
My accent.
It is mesmerized, yeah. But any questions, you might have for Dr. Dimi, send them along. and we will definitely get you on another podcast.
Sure.
Yeah, but thank you guys.
Thanks so much.
Yeah, thank you.
And don't forget to like and subscribe.
Yeah, like and yeah, that's John's contribution.